We start this hour with new details regarding a confirmed case of measles here in Colorado. The state's health department says a person who lives in Pueblo tested positive. Thanks again for joining us. For 4 o'clock at 9 News, I'm Tom Green.
I'm Kim Christensen. State officials say the person tested positive after returning from a trip to Mexico. 9 News reporter Evan Krugel joins us now. And Evan, the state is worried that more people have been exposed.
Kim, it appears that person spent at least 5 days working at a Pueblo Deli before getting tested for measles on March 22nd. While she is recovering, health officials say they're still concerned others may have been exposed. The Southwest Deli and Cafe in Pueblo is now the focus of a state investigation as public health officials try to figure out if a person working here may have exposed others to measles.
This person was an unvaccinated adult with recent travel to Mexico.
Pueblo Health Director Randy Evitz says that test came back yesterday, 9 days after the worker went to an urgent care to get tested. The owner of the cafe says that woman worked in the kitchen and did not interact with customers. He says every other worker is vaccinated against measles.
The good news is that this individual has not traveled outside of Pueblo. And so we believe it is limited to Pueblo, but we do not have any additional sites at this time.
State health leaders say they aren't taking any chances, given the highly contagious nature of measles.
Measles is actually the most transmissible infectious disease that we know of. In fact, it is so infectious that if there are 10 non-immune people that are exposed to measles, 9 of them will go on to develop infection.
94% of Coloradans are vaccinated against measles, and health officials say the vaccine is extremely effective.
The good news, of course, is that measles is highly preventable. We have a highly effective vaccine, the MMR vaccine, that with 2 doses is 97% effective at preventing measles infection and provides lifelong protection against the disease.
Doctors say measles has a particularly long incubation period, so people may not know they've been exposed for a couple of weeks. Those symptoms to look out for include a fever, cough, and that characteristic rash that begins on the face before moving down the body. Guys, that long incubation period, that's why the state's still concerned some other folks may have been exposed.
Yeah, because it's one thing to check about coworkers if they've been vaccinated, but that person went other places in their lives and throughout the day. When you talk about vaccinated, so what should people that have been exposed possibly, should they think, well, do I need another vaccine? What do they do if it's been a long time?
Yeah, that's what makes this so tricky. Most of us are vaccinated when we're really, really little for measles, and that vaccine has changed over time. I just spoke with Dr. Coley a few minutes ago. She says the safest thing to do if you're not sure, contact your health provider. They should be able to look up that information, see what vaccines you've received, and make a good plan moving forward.
All right, serious problem. We knew it was coming here at some point, probably based on what's been happening around the country, but here we are. All right, thanks, Evan.